When I conceived this clinic, it was to minister to the Hispanic community in Northeast Mississippi. I realized that there was such a need broadly across the entire population that this clinic, long before it opened, became a clinic for everyone. We asked them 4 questions. Do you have Medicare? Do you have Medicaid? Do you have health insurance? Can you afford medical care? If they answer no to all 4 of those questions, we see them here in the clinic. We have medications for almost every illness. The big expense for the clinic is medication. We spend every cent we can on medications, and we are able to do so because we have a lot of help and support from the community.
When we first started, we just kind of put the word out that we were going to open, and it was amazing. People just started coming out of the woodworks wanting to help and do whatever was needed.
One of the real services that we're able to offer is insulin for diabetics. Insulin is very expensive. These people can't afford 1 bottle a month, much less 3 or 4.
I've lost approximately 50 pounds because the doctor told me I was overweight.
It's been very gratifying to see these people turn around. Instead of having blood sugars of 500 and 600, to have 120, to be controlled, to feel good, to go out and get jobs.
TSSC is the Toyota Production System Support Center. We're based out of Toyota's North American headquarters in Erlanger, Kentucky. We're actually a nonprofit agency within our headquarters, and we positioned ourselves to do that so that we could give back to our community.
When we opened the clinic, we just moved in one day and started seeing patients the next. So we never really got organized like we should have, like we know now that we could have been. We were just fortunate enough to be able to work with the team from Toyota who does problem solving, and when they first came to the clinic, they observed everything that we were doing, and the problems that we thought we had, actually they saw a lot more.
In TPS, we're always looking for problems to solve or continuous improvement opportunities. And basically we partnered with the leadership and the volunteers here at Tree of Life, and they basically said, our biggest problem is that we have this really long line outside. So that, from a TPS perspective, clearly that's what we wanted to work on.
When I come this morning, 20 till 7, I sit here till 4:30 when they open the door, but they give my number to me around 2 o'clock.
Hurry up, go to your cars, because it's dangerous to be outside.
Then it come a hard storm, and we had to get in our car and sit till 4:30 to get in to see the doctor.
Number 61, 62, 63.
One of the first activities we did was a Genchi Genbutsu, which is a Japanese phrase that means go and see. So each of us on the project team volunteered, and we worked in each process. We got involved, we learned how the job worked, we learned what the issues were, and we diagrammed the flow of the clinic. We also visualized what the problems were and what the bottlenecks were, and then we made a diagram of what we all agreed was the ideal condition. One of the things that we did was to help reorganize the filing system. We purged over 630 files. We now have everything labeled in order. Volunteers can find the file very quickly. The file cabinets, we moved those back, we added a 4th, and we grew the space quite a bit. What that means for the patient is they're getting checked in much quicker and getting to triage much quicker.
We organized the workstations. We standardized what exactly did each volunteer need to perform their job. We made that a standard for all 3 operations, and that helped.
We created this, what we're calling our on-deck next patient staging chair. When the physician's done with the previous patient, the next patient is waiting outside the door for them. So it eliminated all the wait time associated with that problem.
This says 2 a day, but you can take this.
The pharmacy was a little chaotic.
Ventolin is down there on the shelf. Oh, that's down here.
So what we did is we rearranged some furniture and opened it up a little bit. So we created a smooth flow in and out in a circular motion through the room.
This is a very loud waiting room. We input a microphone into each of the rooms, and we still have one central speaker. So now the patients can hear their name called at each of the locations.
Number 57.
The doctors have liked it. The patients have been very vocal about liking that as well.
62, 63.
You know, each project has a specific need. You know, at Tree of Life here, we wanted to focus on how can we get people through the clinic more quickly so that we can respect the time of the patients and respect the time of the volunteers. And that's been our focus from the beginning.
When we come here, people are glad to see us. People thank us for being here. Not only the volunteers, but the patients. It's like, hey, you've made a difference. That's how you measure it. You've made a difference.